Hi, everyone. Uh, Today's class, we're talking about the odontogenesis. The odontogenesis means that the formation of the tooth. I didn't put this topic in this semester in the beginning, but because of the COVID-19, we cannot do the hand-on practice. So I put this topic. That is because when I prepare the topic of the oral pathology, I found that if you don't have the concept about the tooth formation, and then you may not you may have some difficulty in understand some or dental related or disease in the oral cavity. This is a complex process, but don't worry, you just have to remember some key roles or key process during happened in the odontogenesis. Okay, the odontogenesis including two parts of the tooth including two parts. The first part is the formation of the tooth, and the second part is the eruption of the tooth. The odontogenesis started from the epithelial cells, and the epithelial cells proliferate and differentiated, and finally to form a tooth in our oral cavity. So here comes the first question. The teeth were originated from the epithelial cells, and the epithelial cells belong to which one? The endoderm or the ectoderm or the mesoderm? Okay, the answer is the ectoderm. That's why if any congenital disease involved ectodermal abnormality, then patient will have dental abnormality in the same time. For example, a syndrome called ectodermal dysplasia. It's a congenital problem involving the ectodermal abnormality. And for this patient, they also have dental abnormality at the same time, okay? There are 5 processes in the odontogenesis, and these are the five processes. And then let's try to put them in correction order. Let's start. Audio jungle. Audio jungle. Audio jungle. Audio jungle. Okay, let's check the answer. These are the order of the 5 processes, beginning with the initiation, then proliferation and differentiation, and apposition and maturation. Let's see more detail about the differentiation. After the differentiation, the tooth can have different shape. For example, the incisors, canine, and premolar and molars. And the other differentiation results in different composition in one tooth. For example, the enamel and dentine and the cementum, they have different composition of the mineralization. For shape differences, we call it morphodifferentiation. And for the differentiation process involving to have different composition, we call it histodifferentiation. Okay, these 5 processes are classified according to the histologic character of the cells included in odontogenesis. Another classification are according to the completion or formation of the tooth. we divided the whole process of odontogenesis into 4 stages. These 4 pictures represent each stage in odontogenesis. Let's try to put them in correct orders. Okay, I think it's not very difficult because you can you can know the order depends on the shape. So it's small and it is the root formation, and this is bigger than this one, and this is bigger than this one. So this is the order of the odontogenesis. But how about the name of each stage? Let's try to match the name of each stage in correct pair. Audio Jungle. Audio Jungle. Okay, let's check the answer. This is like a bud. So it is a bud stage and it's a cap stage. And when it became longer, it's like a bell. So we call it bell stage. And this stage is the root formation. So bud stage, cap stage, bell stage, and the root formation are the 4 stages in odontogenesis. So if we look the 5 process through the 4 stages of the odontogenesis, the initiation mainly is the main process in the bud stage. And the proliferation process started from the bud stage and then continues through the whole stages of the odontogenesis. And in the cap stage, the differentiation of the cells started. And in the bell stage, a position of the sum matrix and the maturation noted from the bell stage to the root stage. Okay, these pictures are the key players or key process or key organs or tissues noted in the process of the odontogenesis. It looks very complicated, but don't worry, I just want you to notice this key word, and we will learn it more detail through the class. And the most important is I want you to know how the tooth bud and form the enamel, dentine, and pulp, and cementum, and the periodontal ligament. Let's start from a video.
What's amazing about tooth development is how early it starts. This embryo is only 6 weeks old, and yet the epithelium over its mandible is already thickening in preparation for what's about to happen. As it grows thicker, the epithelium creates an island of cells, which is the origin of the new tooth. This is the dental lamina, and its remarkable potential is starting to unfold. As we get closer, we can see other key players in the formation of our dentition. Meckel's cartilage provides support for the developing tissues, and the blood vessels that help shape the embryonic teeth are present. By now, the lamina has grown into a bud. The epithelial cells haven't changed much, but as the bud grows, it starts to bend into a dome in response to pressure from the blood vessels, and the mesenchymal cells underneath condense. At this point, we can already identify the cells that will form the tissues of the mature tooth. The enamel organ is made of cells from the epithelial cap, and it will generate the enamel of the tooth. The condensed mesenchymal cells will form the dentin and the pulp, and they are called the dental papilla. The dental follicle will develop from the remaining condensed mesenchyme. And all of these cells together are known as the tooth germ. So far, we've seen the bud and cap stage of tooth development. The third and most dramatic is the bell stage. As the tooth germ begins to grow, the cells differentiate. The stellate reticulum is now obvious. Made up of star-shaped cells pushed apart by fluid pressure, it separates the inner and outer enamel epithelium. Just visible is a flattened area of cells called the stratum intermedium. We can also see the juncture where the inner and outer enamel epithelium meet. This cervical loop is important in tooth formation, as we'll discover soon. By the time the tooth bud pinches off from the dental lamina at the end of the bell stage, the inner enamel epithelium has folded to form the shape of the future crown. With the scaffold to work on, the masons of the tooth world go to work. The cells of the inner epithelium have elongated into ameloblasts, and the neighboring cells in the dental papilla respond by changing into odontoblasts. Now they move toward the center of the papilla, leaving a thin tube of cytoplasm and a layer of dentin. And now, the ameloblasts start to move, leaving behind the hardest tissue of all, enamel. The resulting rock-hard crown of enamel and dentin is a miraculous feat of cellular engineering, but the engineers haven't finished yet. An extension of the cervical loop forms as a collar called Hertwig's epithelial root sheath that causes other odontoblasts to start forming the dentin of the root. At the same time, the whole tooth starts to move like a biological rocket taking off, and a perfectly formed deciduous incisor is delivered into the oral cavity. Its new owner, of course, is delighted.
Okay, so let's start to talk about more detail about these 4 stages. That's from the bud stage. The most 2 important process noted in bud stage is the initiation and the proliferation. And it started as early as 6 to 7 weeks in the uterus. This is the stomodium. It is the primitive mouth. In the future, we will become of the oral cavity. And this is the oral epithelium. This comes from the outer part of the ectoderm. And deep to the forming oral epithelium, there is a type of mesenchyme originally from the ectoderm. So we call it ectomesenchyme, which is influenced by neural crest cells that have migrated to this area. And during the later part of the 7 weeks, the oral epithelium grows deeper into the ectomesenchyme and is induced to produce a layer, the dental lamina. Extensive proliferation of the dental lamina into buds or ovale masses that penetrate into the ectomesenchyme. We call this tooth bud. At the end of the bud stage, we can see the permanent, the tooth bud of the permanent dentition. At the end of the proliferative process involving in the primary dentition's dental lamina, both the future maxillary arch and the future mandibular arch will each have 10 buds of the primary teeth. And we can notice the permanent tooth bud of the permanent dentition will located lingual to the primary tooth bud. This is the developing primary teeth, and this is the developing permanent teeth. That is why the succeeding permanent tooth usually erupts into the oral cavity in a position lingual to the roots of the shading or shade primary tooth. That is because the tooth bud of the permanent dentition is always lingually to the tooth bud of primary dentition. And in the bud stage, the dental lamina and the tooth bud and the surrounding ectomesenchyme compose the tooth germ. So let's summarize the bud stage. The two process in the bud stage is initiation and proliferation. And it started from the epithelial cell, from the ectoderm. And the epithelial cell proliferate into the ectomesenchyme of the jaw. It started from the 6 to 8 weeks in the uterus for the deciduous tooth for the primary teeth, and 24 weeks in the uterus for the permanent teeth. So the two process in the bud stage is the initiation and the proliferation. Let's move forward to the cap stage. The tooth germ in the bud stage include the dental lamina, the tooth bud, and the surrounding mesenchyma. And the proliferation of these cells continuous and differentiated to form the enamel organ, the dental papilla, and the dental sac in cap stage. Let's see more detail. The tooth germ compose the tooth bud in the tooth germ. It will proliferate and differentiate it into the enamel organ, like a cap. And the ectomesenchyme surrounding the tooth bud will continue to proliferate. And the condensed ectomesenchyme cells in the concavity of the enamel organ, we call it dental papilla. And the surrounding ectomesenchyme, we call it dental sac or the dental follicle. So the tooth germ in cap stage composes 3 parts. The first part is the dental enamel organ derived from the ectoderm. And the dental papilla is the inner mass of the ectomesenchyme. And the ectomesenchyme surround the enamel organ. We call it dental sac or the dental follicle. There is an important part inside the tooth germ. We call it enamel nut. The enamel nut is localization of the cells on an enamel organ, and it is a signal center and determine the tooth morphogenesis and growth of the tooth cups. So that's why the tooth can have different morphology. The enamel nut have the primary enamel nut forms at the tip of the bud during the cap stage of the tooth development. The primary enamel nut undergoes apoptosis and disappears. Later, secondary enamel nut appears that regulate the formation of the future cusp of the teeth. This is another figure to explain the primary enamel nut and the secondary enamel nut. So the key process in the cap stage is the proliferation and differentiation. So proliferation of the tooth bud and dental lamina tooth bud will become to the enamel organ, and the ectomesenchyme become the dental papilla, the ectomesenchyme in the concavity of the enamel organ, and the ectomesenchyme surrounding the dental papilla and enamel organ, we call it dental sac. And these 3 compose the tooth germ.
In the developing human embryo in week 6 of gestation, the teeth will develop in a complex process that involves a myriad of different cell types and tissues. Within the developing jaws of the embryo, epithelial and ectomesenchymal cells will interact with each other to produce teeth. This animation will outline the first three stages of tooth development: bud, cap, and bell. Prior to the bud stage, two bands of thickened epithelium form in the presumptive upper and lower jaws of the embryo. On each band, a ribbon-thin shelf emerges into the underlying ectomesenchyme. This inward growth is called the dental lamina and signals the beginning of tooth development. The bud stage commences with the formation of small bulges on the dental lamina. These bulges grow into the adjacent ectomesenchymal tissue, creating a bud. As the bud grows, it forms a shape similar to a light bulb attached to the end of a rope as the ectomesenchymal cells continue to proliferate around it. As the development process continues, an infolding appears. The ectomesenchymal cells continue to proliferate within that fold. This formation signals the beginning of the cap stage. Several structures can be identified during the cap stage. The enamel organ is the part of the developing tooth made up of epithelial cells originating from the dental lamina. The dental papilla makes up the ectomesenchymal cells filling the concavity of the cap. Lastly, the dental follicle makes up the ectomesenchymal cells enclosing the rest of the enamel organ. Note that the enamel organ and dental papilla are separated by the basement membrane of the epithelial cell.
Okay, let's move to the bell stage. The bell stage started from the 11 to 12 weeks in the uterus. The main process in the bell stage is the proliferation differentiation. And the differentiation include the histo differentiation and morpho differentiation. So let's see the process or the differentiation in the enamel organ and the dental papilla and dental sac. For the differentiation happened in the enamel organ. It is characterized by the continuation of the ongoing process of the proliferation, differentiation, and morphogenesis. And the cap, the enamel organ will divide it into the inner enamel epithelium and the outer enamel epithelium. This is another view that to see the inner enamel epithelium and the outer enamel epithelium. The inner enamel epithelium will differentiate it into the ameloblast. And the ameloblast, through the process of the amylogenesis, and produce the enamel in the future. At the same time, the differentiation of the dental papilla. We can see the outer cells of the dental papilla just beneath or just adjacent to the inner enamel epithelium of the enamel organ. The outer cell of the dental papilla will differentiate it into the odontoblast. And through the process of the dentinogenesis, and it will produce dentin in the future. And the other part of the dental papilla, the central cell or the inner cells of the dental papilla will be surrounded by the future crown and roots, and it forms the pulp in the future. And how about the differentiation of the surrounding ectomesenchyme cells, the dental sac? The differentiation of the dental sac happened during the root formation. So not the differentiation of the dental sac does not happen in the bell stage. It happened in the root formation stage. The cell contact root dentin will differentiate it into the cementoblast and produce cementin in the future. So let's see more detail about the histodifferentiation and morphodifferentiation. The morphodifferentiation means that to determine the morphology of the tooth, and this is regulated by the enamel nut noted in the Bell stage and continuous differentiation and the proliferation in the Bell stage. And how about the histodifferentiation? Let's review the differentiation of the cells. The ameloblasts are differentiated. The ameloblasts are differentiated from the inner enamel epithelium of the enamel organ. So ameloblasts comes from the ectoderm, the oral epithelium, and the odontoblasts are differentiated from the outer cell of the dental papilla. So it comes from the ectomesenchyme. And then cementoblasts are the cells of the dental sac touching the root dentin in the future. So it comes from the ectomesenchyme also. And the process of the apposition and maturation is including the ameloblast. It produced the enamel matrix through the process of the aminogenesis, and the odontoblast produced the predentin and through the process of the dentinogenesis. So in the apposition process means that ameloblast produce the enamel matrix and odontoblast produce the dentin. And in the maturation stage, it means that a mineralization of this matrix. So the enamel matrix becomes to the enamel, and the predentin becomes to the dentin. This is the histology of the odontoblast, dentin, and enamel and ameloblast. This is another picture of the histology. Let's see a video to summarize what happened in the Bell stage.
The details of the events happening in the Bell stage. Let's have a look at the different types of cells constituting the whole tooth germ at this stage. Like the cap stage, the early Bell stage comprises of an inner enamel epithelium lining the concavity of the bell and an outer enamel epithelium lining the periphery of the enamel organ. There are capillary plexuses established near the outer enamel epithelium, which bring in nutrition for the cells of the enamel organ. The inner enamel epithelial cells differentiate in the stage to become tall columnar ameloblasts. Some cells between the inner enamel epithelium and the stellate reticulum become spindle-shaped and form a layer called the stratum intermedium. Now, these cells are speculated to work in tandem with the inner enamel epithelium to form the enamel. The rim of the enamel organ at the cervical region, where the inner enamel epithelium meets the outer enamel epithelium, is called the cervical loop. The cervical loop is an important part of the tooth germ in that it gives rise to a root sheath which proliferates to form the root. The cells below the concavity are called the dental papilla, and those surrounding the enamel organ and the dental papilla constitute the dental follicle. The dental papilla cells near the inner enamel epithelium differentiate under their influence to become odontoblasts. Now, the Bell stage is marked by two events called the morphodifferentiation and histodifferentiation, both happening simultaneously. Morphodifferentiation refers to the establishment of the shape of the crown, and histodifferentiation refers to the coming of age moment, when the dental papilla cells differentiate to become odontoblasts and the inner enamel epithelial cells become ameloblasts. Odontoblasts form dentin and ameloblasts form the enamel. The inner enamel epithelium in the early Bell stage secrete growth factors and signaling molecules which help in differentiation of dental papilla cells to become odontoblasts. Simultaneously, the inner enamel epithelial cells corresponding to the future cusp tip position begin to differentiate into ameloblasts. Once the inner enamel epithelial cells differentiate, they stop proliferating. However, the adjacent inner enamel epithelial cells that have not differentiated continue to divide, exerting a pressure. Also, the inner enamel epithelium is constrained and restricted by the cervical loop. So the pressure exerted by the dividing cells and the confinement of these cells by the cervical loop results in these cells buckling and assuming the shape of the cusp of the corresponding tooth being formed. The inner enamel epithelium and the dental papilla continue to differentiate from the cusp tip down the slopes of the cusp to the cervical region. Hence, the deposition of dentine and enamel begins at the cusp tip and ends cervically. The advanced bell stage is marked by the formation and mineralization of enamel and dentine. When enamel and dentine form incrementally, the stellate reticulum collapses. Finally, the ameloblasts and the outer enamel epithelium fuse with each other.
Okay, so let's see more detail about the histology of the enamel and dentine. Can you see there are some lines in the dentine? These lines are the dentinal tubules. The dentinal tubules are small, hollow, microscopic channels that travel from the inside of the tooth, from the pulp, out through the dentine, ending just beneath the enamel. Within the tubules, there is an odontoblast process, which is an extension of an odontoblast, and the dentinal fluid, which contains a mixture of albumin, transferrin, and proteoglycans. Dentinal tubules do the blood vessels work in the harder layer of your teeth, carrying the pulp chambers nutrients and fluid to the dentine layers. When the dentine loses its protective covering of the enamel, the dentinal tubules transmit hot and cold sensation or acid or sticky fluids to stimulate the nerve inside the dentinal tubules. By the theory of the hydrodynamic mechanism, the change of the temperature will cause irritation of the nerve ending and result in sensitivity and discomfort. That's why we feel hypersensitivity in periodontal problem or when a cavity happened. The mechanism of the desensitized toothpaste is that the content in the toothpaste combined with the mineral ions in the saliva can produce some substance that it can obliterate the opening of the dentinal tubules, so block the irritation to the dentinal fluid, and then the hypersensitivity can be relieved. And there are different types of the dentine. There are 3 types of the dentine. The primary type, it forms prior eruption of the tooth. And the secondary dentine forms after eruption and continues whole life. So that's why the color of the dentine is yellow, because the secondary dentine forms after eruption and continue whole life. So the thickness of dentine will increase. That's why the color of the tooth will become yellower through the life. And the tertiary dentine is the kind of a reparative dentine. It's a response to the trauma. Let's see the more detail about the dentinogenesis.
The process of creating dentin is called dentinogenesis. For primary teeth, it mostly happens around the 14th week of fetal development. And for permanent teeth, it mostly happens when an infant is about 3 months old. After that, the process continues to happen, but at a very slow pace. Dentinogenesis is performed by odontoblasts, and it's done from the outside inwards. So the process starts with creation of the mantle dentin, which is the outermost layer of dentin, right under the enamel. First, odontoblasts secrete a soft organic matrix made out of proteins, which is called predentin. Fibroblasts assist by creating a mesh of thick collagen fibers, called Korf's fibers, which become the framework for dentinogenesis. Think of these as rebar, which help form a very strong wall. Slowly, the odontoblasts and fibroblasts move toward the center of the tooth. Odontoblasts do this by growing a protrusion from themselves, which stays in place, embedded within the matrix, while the rest of the cell moves toward the center of the tooth, toward the pulp. These hair-like protrusions are called odontogenic processes, and they secrete calcium hydroxyapatite, which forms crystals and mineralizes the predentin. This mineralization is like concrete that settles around the rebar to make the mantle dentin layer very strong but also flexible. The end result is mantle dentin, which has numerous tiny canals, which are the dentin tubules, each containing an odontoblastic process. The next layer of dentin is called the primary dentin, and it's the thickest layer. Once odontoblasts have finished making the mantle dentin layer, they get bigger and continue building the primary dentin. Meanwhile, the fibroblasts head towards the pulp to catch a rest. So compared to mantle dentin, the primary dentin contains less collagen and more mineral content. Odontoblasts continue moving towards the center, so the primary dentin forms from the outside in. Next up is the thin layer of secondary dentin. Secondary dentin resembles the primary dentin in structure, but the main difference is that it's formed after root formation is complete and happens at a slow rate throughout our lifetime. Its purpose is to maintain the tooth strength for as long as possible. After the secondary dentin, there's a thin layer called the predentin, which borders the pulp. The predentin is a layer of organic matrix that hasn't yet mineralized. And as it mineralizes, it becomes secondary dentin. Unlike enamel, dentin keeps growing, regenerating, and repairing itself throughout our lifetime. So when a tooth is injured, odontoblasts residing in the pulp move out and head to the site of injury. Once they get there, they start rapidly producing what's called tertiary dentin and mineralizing it immediately. Tertiary dentin is used for damage control in order to strengthen the damaged area. Think of the injury as a crack in a dam. It needs an injection of concrete immediately. That's why tertiary dentin is found at sites like dental caries or dental attrition, caused by excessive wear of the teeth. All right, as a quick recap.
Okay, so let's brief the what happened in the Bell stage. The most important is the differentiation. It includes the morpho differentiation and the histo differentiation. The morpho differentiation is regulated by the enamel nut in the enamel organ. And the histo differentiation includes the differentiation of the enamel organ. There are two main cells of the enamel organ, the inner enamel epithelium and the outer enamel epithelium. And the inner enamel epithelium will differentiate it into the amyloblast. And through the process of the amylogenesis, it produces or accumulates enamel continuously. And another differentiation is happened in the dental papilla. The outer cells of the dental papilla, it means that the cells adjacent to the inner enamel epithelium, it will differentiate it into the odontoblast. And through the process of the dentinogenesis, it produces dentin. And the differentiation of the dental sac mainly happened on the cells touching the root dentin. These cells will differentiate it into the cementoblast, and this will happen mainly in the root formation stage. And the cementoblast will produce cementin in the future.